Well, good afternoon. It's been about 1 month since COVID vaccines were first offered to Indiana residents, um, beginning with the age of over the age of 80. Today, anyone over the age of 65 may get their shot in our state. When they do so, they're not just protecting themselves, they're protecting their neighbors, they're protecting healthcare workers who have been working harder than ever. They're protecting younger residents who are not yet eligible for vaccination. In a moment, we will hear from Dr. Virginia Caine of the Marion County uh, Department of Public Health. Dr. Caine will discuss a few minor changes to existing public health orders in Marion County. And these changes will be around assisted living centers and school protocol. She'll also provide an update on the COVID case numbers and early vaccine data from our local efforts here in Marion County. However, while the vaccine process has been largely a success, considering its unprecedented proportions, we know that locally and in cities and towns across America, Black and Brown residents are often vaccinated at lower rates than white residents. In Marion County, Dr. Caine has been doing important work surrounding this issue of disproportionality, speaking to targeted groups to encourage vaccination, addressing the obstacles presented by accessibility, transportation, and a lack of trust. All of these must be addressed. And Dr. Caine has taken a leadership role in shaping the conversation around these issues and many more. In the coming weeks, we will share more about further efforts to encourage vaccination among historically underserved populations. Equity in public health must be a fundamental piece of emerging from the pandemic and a critical component of building a more united Indianapolis. Because the truth is, as a city, as a state, and as a nation, we have defeated illnesses before. Long ago, maladies that we scarcely hear about anymore: polio, diphtheria, whooping cough, and more. We often did this through a vast program of vaccination. We can, we must, and we will do this again if we unite to defend ourselves. So let me just close by reiterating again and again to everyone in the community: wear a mask, wash your hands, and when it's your turn, take a shot. Take your shot. So with that, I'd like to hand things over to Dr. Virginia Caine, my partner and the leader of the Marion County Department of Public Health. Dr. Caine.
Year, numerous challenges. We've had a very responsive community that have met the challenge. And so I'd like to continue to highlight the great gains that we have made, what our current challenges are, and what we can do to make a difference. If I could have the first slide. Next slide after that. Let me just say that the last time we were presenting our data, we were designated in the red zone in terms of designation of having some of the highest community spread of this COVID-19 virus in our communities. And I'm happy to say that we had reached a positivity rate of 16.4% in the month of December. And as I will reiterate, you're getting back to normal, very limited community spread if you can reach 5% or lower, especially for a period of 2 weeks. And by this slide, it is highlighting that, as you can see, early January, where you can see we were over 15% positivity. Now, February the 4th, the 3rd, we have reached down to a 7-day average of 5.8%. We've done an incredible job of going from a red zone, and we're now into the orange zone. And still with significant spread, but definitely not in that hot zone of COVID-19 infection in our community. Next slide. This slide looks at where we were looking at experiencing over 1,000 cases twice in the month of December, early January, where you can see based on the slide that we were off the charts. But we have now gotten down to a 7-day average of 236 cases. That's a far cry from having over 1,000 cases a day. And we're now averaging no more than 236 cases a day, with my hope and my goal that we will be below 100 cases per day next week. Next slide. When we look at emergency room visits and you look for people and patients experiencing and exhibiting COVID-19 symptoms, loss of taste, loss of smell, shortness of breath, coughing, okay? You can even have nasal congestion, runny nose. But look at the substantial decline in emergency room visits with COVID-19 symptoms, where we were experiencing over 60 visits per day. We're now down to averaging just a little below 20 patient visits in a day going to our ambulances and emergency rooms with COVID-19 symptoms. Next slide. When we look for first-time hospitalizations, because you're so sick with the COVID-19 again, since early January, when we were experiencing a number of hospitalizations, as many as 30, 35 new cases a day, we're now experiencing on an average of about anywhere from 4 to 6 cases of COVID-19 only being diagnosed on a daily basis from all of our emergency rooms in Marion County. Next slide. And of course, probably the most critical challenge and painful process that we experience are our deaths that are related, that impacts our families, our friends, and our colleagues. That while we were having significant deaths early on in late December, early January, we have now seen a decline in our deaths where we sort of have plateaued a little bit, so that we're experiencing maybe on an average of about 4 to 6 deaths per day. And for a city that's got over 970,000 residents, that low number of deaths is just tremendous, tremendous success. Next slide. And how do we compare when we look at our surrounding counties in terms of our percent of positivity? So Marion County is in that middle column, in the middle of those 3 states. And we had a positivity on January the 11th of 12%. And by February 3rd, we had dropped to 6%. But I want you to look at all these counties in terms of positivity. Marion County, of all of these counties from on February 3rd, had the lowest positivity rate of any surrounding county. But I have to give kudos to my colleagues because they're doing a fantastic job and their numbers of positivity rates are going down in a parallel fashion, just as Marion County. Next slide. Now, who's the COVID-19 impacting now in this day and age? You know, when the epidemic started back in March of 2020, you know, it just seems like it was just a short period of time away. 36% of those cases were in our seniors over the age of 60. And we did a remarkable job, but we're now starting to see our cases occurring in our seniors creeping back up. So that this past December, 19%, a fifth of our cases were in individuals 60 years and older. Okay, 60 and older. With the next largest group are our 20 to 39-year-olds who make up almost a half of our cases at 40%, followed by our 40 to 59-year-olds at 59 at 29%. We're staying very flat in terms of looking at our younger generation, less than 20 years of age, maintaining a very low percentage of the cases at 12%. Next slide. And one of the charts that we always look to see and make our determination about it being safe for our children to go back to school, and what do we need to put in place in order for them to be safe in schools, we needed to look at the number of cases that were occurring in our different age groups in the schools to see if the spread of infection in those schools were less than community spread of infection in children outside the school setting. And the slide just highlighted that of our less than 5-year-olds, we were experiencing no more than 7 cases that were occurring per 100,000. And we were looking at our community spread around this time of February the 7th, around about 43 cases per 100,000. And similar numbers from K through 12, we had less than 17 cases per 100,000 population. Even our older adults, since the 1st of January, when we saw a surge, probably related to the holidays, in all of our categories, except for the less than the 5 years of age, you will see that the group with the most cases from January the 1st to February the 9th were in our college students ages 18 to 24 years of age. But all of our age groups have seen a substantial decline in the number of our cases occurring in Marion County. Next slide. So one of the things we had to do and look at is we had to look at how do we make decisions and who should get vaccinated. And we're working very closely in collaboration with the Indiana State Department of Health, who has a very large group of vaccine experts to help make the determination that we look to make the decisions about who should receive the vaccine based on risk of hospitalizations and based on risk of deaths. And as a result, the decision was made to do priorities of people based on their age and risk of death and hospitalizations and being placed on ventilators. Now, our first priority group, 1A, was, of course, our essential healthcare workers, our emergency room staff, in our folks that resided in our long-term care and assisted living. And as you can see, the priority group in Marion County, that particular group, they make up 9,655 persons. We have like 7,308 long-term care residents. We have 20,000 teachers and staff. So you look at the teachers in Marion County and who we'd have to vaccinate, it's 19,560 rounded off to 20,000. And when we looked at the population who were 80 years and older, 29,000 in Marion County. 70 to 79, 51,000. The bracket that we're currently in now of the 65 to 69 is 43,000. And then our next group that we will be looking at, how many residents are there in Marion County, 60 to 64? It's 50,381, okay? And so, and then looking at from 17 to 59, that makes up our last group of 561,000 in Marion County. But now let's look at and see how we've been faring in terms of those different groups and who's being vaccinated. Next slide. When we looked at those who were 70 years and older, who had received at least one dose, we found that 32%, if you were a white resident, 32% of you received a vaccination, who received at least one dose. We have about 60,000 whites in Marion County and 19,000 received their dose. We still have about 40,000 to go based on race. When you looked at African Americans, nearly 3,388 received at least their first dose if you're over the age of 70. And so 19% of African Americans were able to get vaccinated over the age of 70, compared to 32% of their white counterparts. If you were Hispanic, Latino, X population, 23% were vaccinated. In our Asian population, 36 were vaccinated. And we do have people of different multiple and other ethnic races. 90% of them are vaccinated. So you can see that we had a lower rate of vaccination in our Black and Hispanic population compared to our white majority residents. Next slide. Now, this is always of use. You want to say, hey, when can we finish getting all these vaccinations? When is this process going to be over? We know that if we can vaccinate 80% of our total population, enough people will be vaccinated and give us what we call herd immunity. You wouldn't see large outbreaks of spread related to this infection if 80% are vaccinated. And so what this slide highlights is that currently right now, 2,000, or you can round out 2,300 people are getting a dose of vaccine in Marion County every day. 2,300 doses, 2,300 people being vaccinated every day. If we started March the 15th, though, and we're able to raise us giving 4,380 people being vaccinated per day, that's even a little bit less than doubling our current rate now. We would be finished by June the 30th, being able to vaccinate 80% of our population and be protected from an immunity. This is our goal. But if we continue to get only the doses at this rate, we will only be about 50% toward our goal, and it would take us to October the 6th to get vaccinated. All right. So this is how important it is, how incredible it is for us to get and increase the number of vaccines that are coming to the state of Indiana and how much we are getting in Marion County doses from our hospital systems, from our health department, from our community health centers. We have some retail partners, Kroger, Myers, CVS Pharmacy, Walgreens. Currently, we're at this rate for Marion County of 2,297 per day. So a lot's going to depend on if we can get Johnson & Johnson. That is the new vaccine. It is a one-dose vaccine. If that can be finally approved through the FDA and CDC, look to see that they are saying that they can provide 100 million doses by the month of April. So we have our work cut out for us. I believe that to go to the next slide and just talk a little bit about the changes in our public health order that may be of interest to a number of you. We have now moved from the red zone capacity to the orange capacity limits based on the governor's order. One of the new recommendations that is coming out in our public health order today are the ones who visit their loved ones in our long-term care and for assisted living facilities. In our past order, our current order before today, if someone could visit their loved ones if they had a negative COVID-19 test within 72 hours prior to the visit. We have now said that if you're completely vaccinated and you're 2 weeks out from your vaccine, you do not have to be tested. You're considered to have natural immunity, at least we're talking about for a couple of months, so you can see your loved one without requiring to be tested. Or you can get natural immunity from having a COVID-19 infection yourself, and at the end of your infection rate, you would have developed antibodies that will provide you immunity for a total of 3 months or 90 days. So any of these three scenarios would provide and be a safeguard for you visiting your loved ones in a long-term facility. Now let's turn to the schools, because we know that there have been some new guidelines and recommendations coming from a state level. But we are going to primarily retain our prior recommendations with a little compromise here. So all students, our staff, who are within 6 feet of an infected person in a high school. So I've got a student in the high school and they're infected. So any student within a 6-foot radius diameter would be required to quarantine, okay? And currently, we are using 10 to 14 days for that quarantine, meaning that you quarantine for 10 days and you come back to school on the 11th day. But definitely CDC, the Marion County Health Department, and even the Indiana State Department of Health says that 14 days is the gold standard, with less than 0.1% transmission if you do a full 14 days quarantine. But if you're a young child and you're in between kindergarten and 8th grade, whether you wear a mask or not, if a child is positive, any child within a 3-week radius would have to be quarantined at home. So K through 8th grade, whether you wear a mask or not, if someone is infected, anyone within 3 feet of you while you're in elementary, middle school, kindergarten, those individuals would have to be quarantined. Now, there are a number of cases where CDC has recently given out some options of how quickly you can return back to work or how quickly you can return back to school. And one of those options was if you were sick, had a diagnosis COVID-19, but you improved, felt better, you could get tested on the 7th day with a rapid diagnostic test. And if that was negative, you could return back to school on the 8th day. So we're currently not recommending that test option because even if you test negative on the 7th day, you can still have a transmission rate as high as 15%, unless there's special circumstances of how you were doing testing with an individual. So we're saying that if you were positive and you've improved, you have no symptoms, you don't have a fever in the last 24 hours where you're not using a medication to lower your temperature, then you can return back to school on the 11th day or back to work on the 11th day. Next slide. So we have some challenges before us. We have to vaccinate people as quickly as we're able to get the vaccine. We've got an incredible healthcare professional group of providers that are out there just ready to go. We have the capacity. What we will need is to get more vaccine from the federal government reaching our doorsteps. We hope that the new vaccine, Johnson & Johnson, is supposed to be shipping out early March, maybe as late as late February, but sometime in early March. And they're saying that they'll have at least a total of 100 million doses by April, just one company. And we know already Moderna and Pfizer are bumping up their production and making partnerships with other plants to get those dosages out. So look to see us getting significant vaccine, I think by definitely no later than mid-March, and it'll knock us off our socks by the month of April. But incredible job, the work. We appreciate all the cooperation we have been getting from this community with wearing the mask, doing the social distancing, and the infection control has just paid huge dividends based on our rates. So thank you, Mayor Hogsett, again, for your leadership, the hard work that you and your staff do. All of us, our health department included, our hospital systems, our hospital partners, everybody in the healthcare arena. And thank you, Indiana State Department of Health, for working with everybody. But we're making tremendous gains. So just so impressive. Thank you very much. I'll stop here.
Thanks, Dr. Caine. As always, everyone, you can go ahead and put your name and outlet at the bottom right in the Q&A box, and I will call on you and unmute you so you don't have to worry about that either. First up, we have Mickey Shui with IBJ.
Hi, Dr. Caine, Mayor Hogsett. Wanted to see what the latest is on determining fans for the NCAA tournament. Obviously, today's data shows that there have been marked improvements to cases in the city. Just wanted to find out how those factors play into a decision and when a decision might come.
So I didn't know who wants to answer, Mayor, or do you want me to answer?
You're the expert.
Oh, okay. Oh, all right. So We think that we'll hear very shortly, hopefully within the next 1 to 2 weeks, because the tournament is coming upon us very soon in regard to their decision whether they will have spectators. But we will be able to say once we see that final plan and their request, if they indeed want to have spectators, we will be able to help determine what that capacity is related to the numbers. But our numbers are looking very favorable for us. If for us to make a decision, if they make a request for spectators, they're looking very good. And you know, these are always tough decisions because you have to you're balancing the decrease and limiting, trying to reduce community spread. At the same time, you have to look at the economics, making sure that, you know, can we keep businesses open? Can we have a viable city related to this? And so those are those fine balances that we look at and factors that we take into place in making those type of decisions.
Thanks, Dr. Caine. Next up is Erica Heron from the Star.
Hi, thank you. I have a couple of questions about schools. So first, I was wondering, you announced new rules around school operations last month. How
Yes.
many schools have been closed since that time due to those rules, and how many are in that like red category that we talked about? And then also, do you have any sort of vaccine plan kind of in place or ready to go once teachers are made eligible for the vaccine?
So let me see if I can remember all of those questions. I'm having senior moments sometimes lately. So if I had Mayor Hogsett's brain, I wouldn't have as much difficulty here. But number one, since our new guidelines, we believe only one school has been closed. Number two, when we look at our categories, based on the color zone, we have a total of about 12 schools that have a preliminary designation of being in the red zone preliminary, meaning that we have not finalized our evaluation to say whether this is a true red zone. Because sometimes based on the size of your school and how small it is, it can give you sort of a falsely raised numbers where it's really not a true red zone. So we do have, though, 12 schools that are being evaluated and looked at for a red zone, and only one orange zone, which says, hey, you're getting at a high enough level. You need to look at this because we don't want your numbers to be bumped up to red. So when you look at the fact that we've got over 300 schools here and only 12 schools may have the potential of having cases that are higher, are getting close to being above community spread, that's of concern. But so far, I think the schools are just doing a fantastic job. And this honestly is a much fairer process than we had earlier, because in the past, we would have had to close down all schools. Now it's just related to what's happening at a particular school setting. Now, see, I think you had some additional questions. I'm sorry, give me the next questions. Okay.
The second question was about if the county has a plan in place for whenever teachers are made eligible for the vaccine.
So yes, so we're exploring actually different plans related to the teachers. For example, I told you we had about 19,500 teachers and staff. So we're exploring mechanisms where we can have mass vaccination clinics for the teachers. So, and we may be able to, we're looking at the possibility, can we do it by geographic or district areas in terms of vaccinating teachers? And so we're having those preliminary talks right now with a number of teachers to see what's the easiest way to get that done? So sometimes just having people come up to any site and get vaccinated may not always be the best way for us to be able to capture who's being vaccinated, what percentage am I at related to where I need to be for vaccination of the teachers, and where are my gaps. So we're trying to have a plan where we can maybe do it by school systems or geographic areas over a time frame to get our teachers all vaccinated.
Thanks, Dr. Caine. Next up is Russ Dodge.
Hi, Dr. Caine, first a comment. I would just like to compliment you and your staff on how you're handling stuff in Marion County. I became eligible last Monday. I signed up, had my first shot on Tuesday at your facility on Commercial Drive, and it was very smooth. I just let everybody know that just the people have doubts, no, don't, because it's well set up. I have a feeling that some of the bugs got ironed out a month or so ago. But what I wanted to ask, though, was about the teachers, kind of dovetails on the question just asked. In all the neighboring states, we have a situation where the teachers are now being vaccinated. The priorities for the state of Indiana don't have that for the teachers. And I want to know if there is any ability on the city's part to be able to vary from that, if you see the need to have the teachers vaccinated now.
So let me just say that we do not, based on my communications with the state, to vary from the plan that is sent out by the state very categorically. I'll tell you a little something on the side. I tried to let me get the mayor be vaccinated, and they said, no way, Jose, because he didn't meet the eligibility criteria. And I said, well, you know, what if I could fudge his age or something like that? No way, Jose, that could not be done. And they made it very clear to me, some other counties who did not follow the rules, they were told, if you don't stop in the seats, we're going to stop providing you vaccination at all. So sorry, Mayor, I did try on your behalf, okay? And whatever, you're just too young. You got to get it together. I don't know what we can do to mature you, but it just won't happen. So it is a tough situation for us because the teachers are really critical. We know we need them to be in those classrooms. But hey, I got Indy bus drivers that is just as important. They're picking up people that are high risk. I got air traffic controllers. They're bringing in our vaccine to us. And I'll be honest, I almost shut them down last year. I can tell you that now, but I couldn't tell you at the time. And I have so many people on this critical list. How do we make that happen? Okay, where we can get them their vaccinations. And we'd love to get it to them, but we're still are looking at the process of trying to get only those who are at the highest risk for being hospitalized, the highest risk being on a respirator for weeks where they may not make it, and the highest risk for those who may be dying. And the only example where I can highlight that to you is look at Los Angeles County, okay? Their intensive care unit beds are full. Their regular heart attack patients are in the hallways. And so we've got to safeguard and protect our healthcare workers, because without us, we can't take care of you. But we don't want to see the deaths. We don't want to see the hospitalizations if we can avoid it. And we are going to say, and we feel very, very hopeful that we're going to get the beginning of large shipments of vaccine by March 15th, and that we can quickly get through 20,000 teachers. We can quickly get through maybe 400 or 500 Indy bus drivers, our grocery store workers, essential workers. When this epidemic started, People were scared to go out their door, and yet they were right there in that service line helping provide needed food. So these are tough decisions, very, very painful. And I say that because my father was a teacher, my mother was a teacher, my brother is a teacher, my sister is a teacher, and believe it or not, I do some teaching too on a level at the School of Medicine. So I know how important this is, but these are tough trade-offs. If I have a 50 or 60-year-old and they're immunocompromised, they've recently undergone chemotherapy, do I give that person a vaccine over a teacher who may be 20 or 30 years of age, who may not be hospitalized, who may not be at high risk for intubation? And so we're having to try to be adaptable and flexible just based on the number of vaccines we are receiving, and it's a different amount of allocation every week for us. But so I'll stop there.
All right, thanks, Dr. Caine. We have time for just a couple more. So the second to last one will be Abdul Hakim Shabazz from Indie Politics.
Oops, there we go. Can you guys hear me? Good afternoon, Mr. Mayor. No crime question today, so we're all good. It is a legislative question, though. Do you think that there is maybe an anti-Indianapolis sentiment that's maybe a little bit bigger than usual with the Indigo legislation, the zoning with townships, IMPD, and the recent override of the governor's veto with landlord-tenant? What are your thoughts on how Indianapolis is getting treated this session?
Well, Abdul, I think there's a much higher number of Indianapolis interest and Indianapolis-centric legislation proposed. Why that is, I mean, you're probably in a better position to speculate. I would just say this: we are still. I mean, this is the 11th of February. And as you know and appreciate, Abdul, the session theoretically does not have to end until April the 30th. So we're still in the early stages. And I talked to legislative leadership and have for a long, long while. And most recently, legislative leadership of this particular General Assembly. And, you know, the refrain that I always hear is, don't judge us where we are today. Don't judge us where we may happen to find ourselves a month from today. Rather, judge us, if you are to judge, you know, where we end up. And I think that's a very rational and accurate way. It is not unusual that bills are introduced in the early stages of the General Assembly that never make it out of their house of origin, and we are not at that point yet. There are bills that will be changed fundamentally. So I guess the totality of my answer would be Indianapolis seems to be a focal point in many respects. I am disappointed in the Senate's decision to override the governor's veto of our landlord-tenant legislation, but the House has yet to act in that regard. So I remain cautiously optimistic, and the city of Indianapolis has taken the position that we will work very diligently in furtherance of amending bills in ways that satisfy the desires of the General Assembly, but also take into consideration the needs of the city of Indianapolis. I mentioned the landlord-tenant the legislation. You know, I have an obligation as mayor to protect our most vulnerable residents. I also have an obligation to promote transparency and safety, and I also have an obligation to encourage equitable economic development. So I'll try to use the power of this office to fulfill those obligations. I know that we have had many department heads and representatives from Indianapolis organizations and businesses who have been testifying as it relates to many of these items while they have been in hearing. And I believe that that testimony has been very effectively arguing the position that the city of Indianapolis takes. So I would refer you back to their testimony, and you can make your own assessments as to its effectiveness.
Thanks, Abdul. Thanks, Mayor. We have time for one more question, and that will go to Erica Washington from Chalkbeat, Indiana.
Okay, thank you so much. So my question, I'm just trying to get clarification on the new Marion County guidelines and how it is different than the state guidelines that just came out. So I know Indiana health officials, they are no longer requiring quarantine if those that were exposed were 3 feet apart, and they shortened quarantine to 10 days. In Marion County, it sounds like they do need to quarantine if they're 3 feet for K through 8. I guess the similarity is that the kids still have to they don't have to quarantine for as long. So I guess I'm just trying to figure out what's the differences between the county guidelines and the state guidelines now.
So I can answer that real quickly. So let's just say for the governors, the state's guidelines, if I was a kid in a classroom and I was wearing a mask and the teacher was wearing a mask and I was K through 8, they're saying that if we found a child that was positive in that classroom, I wouldn't have to have any of the kids sitting in front of him or behind him or to the side of him. They wouldn't have to leave the classroom and be quarantined where they're out of the school doing virtual learning for like 10 days. And the implication is with this is that the state feels comfortable that the mask is effective with both teachers and the child wearing it, so they're not concerned about any of the other kids being infected. I think for us, we're just a little bit more cautious because we're seeing this new mutant strain that is starting to come into different communities. And so our research data is based on our current strain, but if you've got a strain that's way more contagious, we just want to be a little bit more cautious. So we do feel that they have to be quarantined, unlike the state for right now. So we just want to have a little bit more experience and see what's happening.
All right. Thank you, Dr. Caine. Thanks, everyone. I will send out the slides from today to the folks on this. Feel free to reach out if you have any extra questions or don't receive the slides. See you next time. Have a good Thursday.